Improving the health of an entire community involves many touch points, including long-term efforts to change the social and environmental factors that impact health. Michigan-based Trinity Health understands this and is tackling the big picture. It has designed and partially funds health and wellness programs at 8 sites across the country that use a comprehensive combination of programs and partnerships to address deeply embedded obstacles to better health. It's called the Transforming Communities Initiative, or TCI, and the early verdict? It's making a positive difference. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer for AHA. Now in its 3rd year, the Transforming Communities Initiative collaborates with community partners to identify health priorities, in particular youth tobacco use and childhood obesity. TCI has already shown it can be a policy influencer. 7 of the 8 states it operates in have passed more stringent laws regarding the purchase of tobacco. TCI has a broader agenda as well, working on behalf of affordable housing and increased access to fresh, healthy food. In today's podcast, Julia Resnick, Senior Program Manager for the Value Initiative at AHA, explores the secrets to TCI's success with Jaime Dircksen, Vice President of Community Health and Wellbeing for Trinity Health. And now to Julia.
Thanks, Tom. Hello, I'm Julia Resnick, Senior Program Manager at the American Hospital Association. This podcast series is part of the Value Initiative, which highlights how hospitals are improving value and affordability for their patients and communities. These members have implemented strategies that enhance the patient experience, improve quality and outcomes, and lower cost. In today's Members in Action podcast, I will be talking with Jaime Dircksen, Vice President of Community Health and Wellbeing at Trinity Health. We'll be discussing Trinity Health's Transforming Communities Initiative. Thank you so much for joining me today, Jaime.
No problem. Thank you.
Let's start with some background on the Transforming Communities Initiative with Trinity Health. What motivated Trinity Health to launch TCI?
I think that we at Trinity Health acknowledge that there's 2 things. One, tobacco is the leading cause of preventable death in our communities. And we know that healthcare only accounts for 20% of a person's health. And so we knew we had to do more. And our first step in doing more was launching the Transforming Communities Initiative, which I'll further relate to as TCI. And so TCI really was designed to have both our hospitals and our communities come together to address big issues around how to prevent tobacco use, prevent obesity, particularly childhood obesity, and address the social determinants of health.
So what problems exactly were you trying to address?
So we were really trying to solve big problems through the use of policy systems and environmental change, because we believe and know that policies have long-lasting impacts in communities. And if we work together with community residents, our hospital leaders, other community-based organization leaders, that collectively we can make a larger impact in communities. And so in many of our communities, there were high rates of youth smoking. And interestingly enough, the vaping epidemic was barely a thing a few years ago. And so we were working really hard to pass Tobacco 21 in our communities, because we knew that if we could raise the legal smoking age, we would prevent more young people from being able to smoke. But then also quickly realized that vaping was becoming a thing, and tobacco, regular traditional cigarette use, was not such a big problem in youth, but that we really needed to start looking at vaping. And so because of TCI and our ability to sort of have this sort of laser focus on reducing tobacco use, particularly in young people, that we recognized quickly that vaping was the tobacco use problem, that we could switch gears and start doing education, start working on flavored bans in communities, in addition to continuing our efforts around Tobacco 21. So tobacco was a big problem we were trying to solve, because tobacco use creates significant health problems across the lifespan. Even if you were to stop smoking as a young person, the health effects of smoking last for decades. So the other big problem we were trying to solve was childhood obesity, which was continuing to rise across the country. And the only way we knew we could combat it was to really start with the youngest of people, including creating access for breastfeeding, creating healthier school environments, and creating community environments which supported people having health be the easier choice. So those were the two primary problems that we were trying to solve.
Great. And I'm sure that this doesn't exist just in a vacuum as TCI. So how does it align with all the other priorities at Trinity Health?
So tobacco and obesity are national strategic priorities for Trinity Health. They have been, which is why TCI supports those national strategies. However, there are many other clinical and cost-saving strategies that Trinity Health has around reducing readmissions, reducing cost of stay. And we know that people who use tobacco and people who have weight concerns are more likely to show up in our EDs and in our hospitals because they have either chronic conditions such as diabetes, COPD, congestive heart failure, but they also are showing up for reasons that are not necessary because we targeted TCI in communities that were facing a lot of poverty. And so people living in poverty have less access to health care. They also have less of a priority to focus on their health care because they're more concerned about where food and clothing and shelter are coming from. And so our efforts around TCI, we're trying to address root causes of poor health that we believe and hope will make a difference in the number of people being readmitted and the cost of stay for our patients.
That's really great work that you all are doing, and I'd love to dig a little bit deeper into what TCI actually does. So what exactly is it, and what work are your hospitals doing to transform their communities?
TCI is a innovative funding strategy led by a health system in partnership with community-based organizations. The resources that the Trinity Health provides to communities go in most cases to our hospital partners in that community. And the expectation is that there's a multi-sector collaborative that's coming together to solve the problems that community has deemed to be their greatest challenges. So we have our hospital leaders at the table with public health departments, with K-12 education, with early childhood education, with police and safety, with nonprofit organizations such as food banks or housing advocacy organizations. All of these individuals, again, depending on the community, are coming together to solve problems. Now, most of the problems they were trying to solve were around tobacco use among young people, childhood obesity, breastfeeding access, complete streets, and then policies in the K-12 environment, particularly related to the nutrition environment, not only the school lunch and breakfast program meals, but also the a la carte opportunities that are being served to children, and the early childhood environment, food environment as well. And then in the K-12 environment, also looking at physical activity. So not only ensuring there's access to recess, but also ensuring that physical education is standard curriculum across the school districts where TCI is operating. And so in every community for TCI, there's a lead community-based organization. And so, for instance, in Syracuse, it's Center State, which is essentially the Chamber of Commerce in Syracuse. And so they hire a program director. Every single TCI site has a full-time program director who's sort of leading this multi-sector collaborative to A, design the strategy, B, ensure implementation is happening, and to disseminate the resources that TCI and Trinity Health provides to make the change happen in those communities. Additionally, every single community is expected to have a local evaluator, and this evaluator works both with Trinity Health as well as Georgia Health Policy Center at Georgia State University to look at sort of how TCI is performing and improving the lives of the people who live in the communities that TCI is serving across the country. And so just to back up, TCI is in 8 communities: Fresno, California, Boise, Idaho, Montgomery County, Maryland, Syracuse, New York, Trenton, New Jersey, Maywood, Illinois, Hartford, Connecticut, and Springfield, Massachusetts. And every one of those communities has a program director and a local evaluator who work in collaboration to ensure the success of TCI.
That's great and really exciting to see Trinity Health acting as the convener in all of these cities. So I know that TCI has been using social impact investing, and I was hoping that you could explain to our listeners about what exactly that is and why you're using that as a strategy.
Definitely. So as I said earlier, TCI is an innovative funding model. So there are three components. One, grants from the Trinity Health system. Two, access to the Trinity Health Social Impact Investing Loan Program, which I'll speak to in a moment. And three, matches from the communities in which we are funding. So every community that receives TCI dollars is expected to match 50% of those resources in either cash or in-kind contributions. So with this social impacting loan program, Trinity Health has support from our board and our senior leadership to use some of our balance sheet to give opportunities to local nonprofits or housing entities or other community development finance institutions to have access to loan capital to further invest in communities. And so social impact investing is traditionally a loan. It's a low interest rate loan, particularly from Trinity Health, that we would offer to multiple kinds of institutions, typically nonprofit, but not exclusively nonprofit organizations, so that they can either A, build a grocery store. For instance, in Hartford, Connecticut, the community has been working really hard on food access issues. There's not a single grocery store in the city of Hartford. And so they're working to build a grocery store in Hartford. And Trinity Health is working to provide social impact investing dollars to the city through a CDFI, Community Development Finance Institution, to make sure that that loan and all of the financing that goes to creating a grocery store is in place so that the community can have access to fresh and affordable foods. And then a lot of our social impact investing actually goes to supporting housing primarily. And so we work with developers to sort of add resources, again, capital loan resources to the capital stack that is needed to build affordable housing. And, you know, we have several other examples where just because Trinity Health was at the table, you know, the health system and the local hospital. So for instance, in Springfield, Massachusetts, they have recently opened a culinary nutrition center, which is a distribution and food processing center that supplies the meals for all children in Springfield Public Schools. About, I think, 26,000 meals a day are served through this center. Fresh food comes into the culinary center, is made fresh, and is disseminated every day to the schools in Springfield. And so they were short on the equipment costs that they needed to make the center happen. And Trinity Health was at the table working with the city of Springfield and Sodexo, who is the food service provider, to say, we're willing to give you this low interest rate loan to sort of make you whole. And at the end of the day, actually, Trinity Health never did make that loan because we were at the table, all of their sort of bankers and all the financial institutions involved sort of saw the value of this project, that there were other large institutions sort of at the table supporting the project, that they got all the capital that they needed from the traditional sources where they would have sort of obtained the capital. Mm-hmm. So we use social impact investing to really try to leverage the sort of financial capital that Trinity Health has to offer a community that can really take a project to the next level. And we usually are not financing an entire project. That's pretty rare. We definitely supplement the projects whenever we have the opportunity. And, you know, this doesn't sort of hit our bottom line. We don't lose money on this, but the communities are gaining assets because of our contribution to the developers and or the other financial institutions that are involved.
Yeah, and that's really the beauty of collaboration, isn't it? When everyone can leverage their resources and assets and skills so that it's everyone's project.
Absolutely. Yes. And that is truly the beauty of TCI, the coming together of all the multi-sector partners who sort of see the value add of collectively working together to solve problems, and just the ripple effect of how these communities coming together have identified new problems along the way and have mobilized to sort of start solving these other new problems that they didn't realize were the real problem when they started.
Mm-hmm. Do you have an example of that?
If you want, I will have it. Yes, I was like, if you want an example, sure. So, for instance, in Maywood, Illinois, they, were working on childhood obesity in the local schools, working with Loyola School of Medicine and School of Nursing, as well as our hospital, Loyola Medicine, and really working together to sort of figure out how to embed, healthier school environments. And they also were really trying to figure out how do we create healthier access to physical activity in the neighborhoods. And there was, a lot of violence in the neighborhoods, and they sort of had a day of action and very quickly learned by engaging residents that the problem wasn't that the park needed to be rebuilt. The problem was the lighting and the safety of that neighborhood needed to be addressed. Mm. And so they sort of came back and said, well, can we, we can't really focus on complete streets or, breastfeeding, for instance, because we actually really need to focus on violence and safety in our communities. And really at the root of the violence and safety is the lack of economic opportunity. And so we have this one little garden that we're trying to sort of make a learning center for the students at the high school across the street, but also a place where residents can get fresh food at no cost that our local catering business is using in their business. And so maybe we want to really build residents' understanding of how to start their own businesses and to use food really as the economic engine in Maywood. In the last 3 years, they have gone from, I don't remember the exact square footage, but let's say 2,400 square foot to 116,000 square feet in 3 years of community gardens. They've created 22 jobs because they all came together and realized this is what's going to solve the root of the issues at the community level is creating jobs and creating access to food, because like Hartford, Maywood also doesn't have a grocery store. And so these very sort of hyper-local community farms and urban gardens are making that resource available to residents. And they've created pop-up farmers markets. They sell them at the local restaurants in Maywood, and the catering businesses are starting to use those resources as well. So I think that this is the ripple effect that we're seeing from this multi-sector collaboration.
That's such a great story, and I love how it really ties together all the social determinants of health, recognizing that it's not just one, but they're all part of the same ecosystem.
Exactly.
So I want to pick up on a comment that you had before about the value add of working collaboratively. And you had also mentioned that TCI has some evaluators who are looking at impact. So far, what impact have you seen on your patients and communities as a result of TCI?
So I think that we'll start with we recognize and understand how long it takes to measure community impact. So even if we pass a policy today, the impacts of that policy are not going to be seen tomorrow. And if we, build a garden today, it takes a long time for residents to understand what it is, to have enough food to feed, more than 20 people. Like scale is very challenging. And so our evaluation approach is to use the RE-AIM methodology. And it's really looking at reach and impact of the evidence-based policies and interventions that we're using across the 8 communities. And so far, we've seen that because of Tobacco 21 as a policy priority in the tobacco space, every single state, with the exception of Idaho, has passed Tobacco 21. And that's reaching over 7 million youth between the ages of 15 and 17 who, are likely not going to be engaging in the purchasing and starting of smoking because of this new policy. And so that's huge, over 7 million youth. And so the schoolwork, we had a very intentional process of working with each of the school districts in our communities to, assess their wellness policies because they all participated in the free and reduced meal program, to really understand what the opportunities were to improve those school wellness policies, and then to make changes in those wellness policies. So, for instance, in Maywood, they passed a policy sort of outside of the wellness policy saying they needed to add 10 more minutes of recess every day during the school year. that creates 10 more minutes of potential physical activity. So we've looked at, we've reached over 240,000 youth through different changes in policies at different school districts across the TCI communities. In Maywood, we also used active recess. So a very simple act of painting activities on Black playgrounds to sort of give children the opportunity to be active because there's a beautiful, drawn playground versus a giant open blacktop. Mm-hmm. That alone creates opportunity for physical activity. We've built, many new playground equipment and different sort of exercise opportunities in many different early childhood environments across the TCI communities. We've also seen changes in breakfast in the classroom. So really instituting breakfast in the classroom as a standard in our TCI community so that children don't have to be hungry at the start of the school day, and the stigma is removed because they're eating breakfast in the classroom versus having to come to school early to eat breakfast. We have seen the communities sort of enhance different levels of their wellness policy, where healthy fundraising is now the policy, healthy celebrations is the policy. These things that seem so small, every month a kid has a birthday party and they're bringing in cupcakes and cookies. Now they bring in pencils and stickers and notepads and, things that are just as fun, maybe not as tasty, but just as fun. But they're promoting, this notion that we don't need to use food as the reward. Food is something that we should celebrate. Food is very cultural and personal, though most children in low-income communities, the only meals they eat are the meals they have in school and the food they have access to in school. And it's so important that those are nutritious meals that provide a model of how one should eat on a day-to-day basis. And so we've seen over 240,000 youth reach through our school wellness efforts. And we've also seen a lot of, I don't remember the number, but through TCI, food access actually wasn't a primary initiative. And people in communities quickly realized that to address the obesity epidemic, we had to address the food quality, the food affordability, the food access challenges that these communities had. And so 6 of our 8 communities launched food access initiatives, which, meant community gardens, mobile kitchens, corner store initiatives where they were working with corner store owners to sort of think differently about how they sell their products, where they place their products, how they incentivize individuals purchasing healthier versus non-healthy products, and really just the impact that is making and the reach that that's having on communities. And so we're 3 years into TCI. We have not seen health outcome at the community level change. I mean, unfortunately, we haven't seen that because the data doesn't exist. We aren't paying to do biometrics in schools to track BMI, for instance. Mm-hmm. In some of our communities, we are assessing through surveys similar to the Youth Risk Behavior Survey, what are the behavior changes among young people. And however, I should say, those surveys were done at baseline and will be done again at the end of 4 years. So we don't yet have those data, unfortunately. But we can confidently say the policies that we've put in place because of the research and the evidence that's available says when you do X policy, less people smoke. When you have strong school wellness policies and strong nutritional content in schools, children have lower BMI. So we use this framework because we don't have to evaluate the evidence of the work we're doing because that's already been done, but we can look at the reach that these policies are having. And just the small sort of intentional bouts of resources put into place to sort of accelerate these policies is definitely making a difference. We never imagined that we would have passed Tobacco 21 in all these states in less than 3 years, or that every single school district would have improved their school wellness policies, or that we would have created all of these food access initiatives. But the intentional focus, I think, is what really makes a difference.
Yeah, and the reach that you have to those policy and environmental changes is really impressive.
Yes.
So you said you're 3 years into TCI?
We are in year 4. We have finished 3 years.
And I'm sure that over that time you've learned a lot from doing this work. So what lessons can you share with others that you've learned along the way?
We have definitely learned a lot. You are correct. I would say there are some really big learnings. First and foremost, it takes a good amount of time to start new multi-sector collaboratives. There's a lot of trust building that needs to happen and a lot of convening and sort of relationship building that has to happen before people can come together and agree on priorities. And I will also say that even though hard data may say A, B, and C are the challenges in these communities, that the communities are only ready to address B and C potentially. And funders need to be cognizant and flexible around that because you can't force a community to do A if they aren't ready to do A or the political will isn't there to do A. And I will say, for instance, in Idaho, our hospital leaders, the community-based partners that are engaged are 100% in on Tobacco 21. And the state legislature is not. And they have tried 3 consecutive years in a row to pass Tobacco 21 at the state level, and they have failed. I mean, it hasn't passed. Mm-hmm. And they don't see it as a failure, though, because every year they make incremental progress in the votes that they achieve. And so they are seeing the sort of culture shift happening. And they're going to try again in February, the new legislative session, January, February. And I think that they also learned, similarly, this is quite shocking, but breastfeeding was a misdemeanor in Idaho up until 2018. And they went multiple years to the legislature to try to remove that and won in 2018, fortunately for all women in the United States, being the only last state in the nation that had a misdemeanor for breastfeeding in public. So they engaged women, moms, new moms, to really be the leaders in the messaging around why it's important to feel safe and have space and feel comfortable to breastfeed their child in public. And so we learned the same thing around Tobacco 21. You engage the people that the policy is going to impact the most. And so youth leadership and youth engagement, particularly I would say in Hartford, youth in Hartford, Connecticut were really energized around Tobacco 21 and, really short order. They were able to pass Tobacco 21 in Hartford and then almost instantly pass it at the state level because of youth. And so I think that one of the most important learnings that we've had to date is the necessity of engaging residents and the individual who is most impacted by the work that you're trying to do. So if you're trying to solve food insecurity, you need to have individuals who are food insecure at the table telling you as the funder or as the CBO leading the work that this is how we think you can solve food insecurity. This is how we think you can solve homelessness. This is how we think you can improve the school environment. Too many times we go in with our ideas and try to implement them and they don't work because we never engage the person who the idea is going to affect. And I think that's been one of our number one learnings, and the recognition that community engagement is so important. If you want to pass a policy, if you want to think differently about how you fund an initiative, if you want to just change a bus route, like all of these things affect individuals, and we have to think about how that change is going to impact them and really hear the voice of the person who's going to be impacted. So I think that's been a really important learning.
Absolutely. So what is next for Trinity Health and TCI?
Oh, that's such a great question. And I wish I had a solid answer on that. TCI will continue through fiscal year 21. It's a 5-year initiative. And so we will have our final evaluation sometime shortly after that. We know that we will launch a new funding initiative sometime in spring of 2020. We don't have the specifics of that just yet. But what we do know is the learnings from this effort are absolutely critical, and that the root causes of poor health are really where we need to sort of drive our work in collaborations with the communities that we're trying to serve. And I also think that from a learning perspective, that we do know that the places, or the TCI communities that have had strong hospital leadership have seen greater improvements and faster, probably is what I would say, faster success than those communities where the leaders at the hospital were maybe less engaged. So even though we may have an expectation that you need to be at the table, it might have been at the table from ensuring the community-based organization gets their money on a regular basis. And yes, that's super important. Don't get me wrong. But the hospital brings a significant amount of political capital, and the hospital really needs to use that in a positive way to impact communities positively. And so I think that, we definitely will have a greater expectation of what it means for the hospital to be engaged and participating in these multi-sector collaboratives.
Yeah, Jaime, this work is truly an excellent example of how hospitals can invest in their communities in order to address the social determinants of health and then ultimately improve health outcomes and reduce cost. Thank you so much for joining me today and sharing all the important work that you're doing with Trinity Health.
Well, thank you so much for having me.
For more podcasts and additional tools, resources, and education to help you promote value in your community, please visit the Value Initiative's website at www.aha.org/thevalueinitiative. This concludes our discussion today. Thank you for listening.